This podcast is going to deal with the heart. In your learning objectives, we should be able to recognize sections of the heart on glass slides and on histological images. Furthermore, you should be able to recognize components of the heart. So we'd want you to be able to recognize the heart valves, the actual heart wall itself, which would consist of cardiac muscle, and Purkinje fibers. Very important, we hope you'll be able to correlate what you're going to learn in histology with what you've already learned in gross anatomy, and correlate that to what you will learn in physiology with respect to the structure and the function of the heart. Now let me just give you a quick overview of the cardiovascular system. This is not a surprise to anybody, but you can think of the cardiovascular system as a transport system to and from. So you could transport cells, nutrients, waste products, hormones, and antibodies to and from the blood, and likewise to and from the lymph. The components in the cardiovascular system would obviously be a pump, the heart, and pipes, blood vessels and lymphatic vessels. We're going to have a series of podcasts that deal with the lymphatic system, and that's when we'll talk about the lymphatic vessels. So if we talk about just pipes for the cardiovascular system, the so-called blood vessels, we're talking about arteries, arterioles, capillaries, venules, and veins. I'd also like you to remember from gross anatomy what would a portal system be, and I hope you'd remember that a portal system would be a blood vessel between two capillary beds. So you would have learned about the hepatic portal system in gross anatomy. That would be the portal vein, which is connecting the capillaries in the GI tract to the sinusoidal capillaries in the liver. So a blood vessel between two capillary beds. Here the hepatic portal system being a venous portal system. We'll talk about some atrial portal systems in other podcasts in other areas of our course. As you know from gross anatomy, there are two circuits that distribute blood in the body. There's the pulmonary circuit and there's the systemic circuit. So pulmonary circulation, you know this already. Blood from the superior and inferior vena cava go to the right atrium, and from the right atrium to the right ventricle, to the pulmonary arteries, and then to the lungs where it will get oxygenated. From the lungs, the blood goes to the pulmonary veins, then to the left atrium, left ventricle, out through the aorta to be distributed in the systemic circulation throughout the body. Now the heart maintains unidirectional blood flow. You also know this from gross anatomy. There are 4 chambers with valves between the chambers to prevent backflow of blood. So there's the atrioventricular valves, the so-called mitral and tricuspid valves, and the semilunar valves, the so-called aortic and pulmonary valves. There are septum that separate the right heart from the left heart, the intraatrial and intraventricular septums. You know about these from anatomy, of course. And you know about the coronary vasculature. So for example, the right and left coronary arteries. You know that the coronary veins drain into the coronary sinus, and these drain into the right atrium. It is not a surprise to anyone that the heart is mostly composed of cardiac muscle. We talk about a fibrous skeleton in the heart, a dense irregular connective tissue. This has 4 rings that surround the valve openings, 2 trigones to connect the valve rings, and septa. The fibrous skeleton also provides attachments for the myocardium, the so-called cardiac muscle, and very important, the fibrous cardiac skeleton provides electrical insulation between the atria and the ventricles. We also talk about the conducting system of the heart, so-called Purkinje fibers. These are modified cardiac muscle cells. And the heart wall itself is composed of 3 tissue layers. There's an epicardium, which is composed of mesothelium, loose connective tissue, and adipose. That makes up the pericardium. There's the myocardium, the major component of the heart wall. That is essentially cardiac muscle. And the endocardium, which consists of endothelium that line the chambers of the heart. There's a subendothelial connective tissue with some smooth muscle associated with it. And just as the heart is divided into 3 basic layers, those layers are recapitulated in the blood vessels. And when we talk about the blood vessels in a later podcast, you'll appreciate that. The diagram on the left shows the fibrous cardiac skeleton. It's a dense connective tissue network, and it's just shown on the diagram as the blue. that I'm highlighting like this. So all of this would be considered the cardiac skeleton. So I'm just going around it with my pointer. The cardiac skeleton, as we said, serves as the attachment site for cardiac muscle and for the valves. And as we said, it allows for electrical insulation between the chambers in the heart. And note the opening in the cardiac skeleton for the atrioventricular bundle of His. The diagram on the right shows the four chambers of the heart that you know so well from gross anatomy. You can see the sinoatrial node, the SA node, the AV node, and the AV bundle of His, which is going to divide into the left and right bundle branches. Here's a horizontal section of the heart through the ventricles. Note you can see the mitral valve in the left ventricle and the tricuspid valve in the right ventricle. The chordae tendineae, or so-called tendinous cords, attach the free ends of the valves to the papillary muscles, and the chordae tendineae contain collagen 1, collagen 3, and elastin. You can also see how much thicker the left ventricle is compared to the right ventricle, and you should understand why that's the case. If not from gross anatomy, then you'll certainly pick it up in physiology in just the next few days. But clearly you know that the left ventricle is pumping the majority of the blood through the systemic circulation. Let me talk for a little bit about the layers of the heart and the pericardium. The pericardium actually has two layers. There's an external fibrous layer, the so-called fibrous pericardium. That's a thicker layer of connective tissue. You can see that on the diagram like this layer of connective tissue and adipose tissue, the so-called external fibrous layer. And then there's an internal serous layer, the serous pericardium. That's a thinner layer, and that actually secretes a fluid. And the serous pericardium can be divided into the parietal and visceral layers of the pericardial sac. And you should appreciate that from gross anatomy. The layers to the heart, then the epicardium, the outer surface of the visceral pericardium, so it would therefore be mesothelium plus adipose. That would be shown like this on the diagram. The myocardium, the thickest layer, which would be cardiac muscle, and then the endocardium, the inner layer, would be the endothelium that lines the chambers of the heart and the underlying connective tissue. This is just a histological view of the epicardium, the visceral layer of the pericardium. So you can see the simple squamous epithelium here, the so-called mesothelium, and then the subepicardial adipose tissue like this, just some kind of connective tissue associated with it. There may even be some nerve bundles that you see occasionally, some blood vessels that run through here occasionally. So the epicardium is actually the visceral layer of the pericardium. The heart itself, if it was on the slide, would be in this area. Here's just a relatively low power view of a section through the heart. So we're looking here at a level through the coronary sinus. So here's a little bit of the wall of the atrium and a little bit of a wall of the ventricle. The arrowheads, which are right here, would be in one of the chambers in the ventricle, point to the endocardium. At a high magnification, you can note that the endocardium contains endothelium, a middle layer of subendothelial dense connective tissue, shown like this. There are some occasional smooth muscle cells that you can see in that subendothelial connective tissue. And then there's a deeper layer of the subendocardial layer that contains Purkinje fibers. And then you can see cardiac muscle fibers in the myocardium proper. Now, here's a little profile of the mitral valve, and we're going to, on the next slide, be right at this level of the mitral valve. So this shows a portion of the mitral valve showing both the atrial and ventricular side. So note there's endothelium, like that, and like that, on both surfaces. The spongiosa, fibrosa, and ventricularis are different components of the connective tissue core of the valve. The spongiosa is a connective tissue on the atrial or blood vessel side of the valve, and That functions as a shock absorber to dampen vibrations of the valve when it opens and closes. The fibrosa is a dense connective tissue core in the valve. It's a direct extension of the cardiac skeleton, and the ventricularis is also a dense connective tissue that continues into the chordae tendineae. Contraction in the heart is synchronized by modified cardiac myocytes. Cardiac muscle, as you know, contracts intrinsically without any stimulation from the nervous system. Electrical activity, so-called depolarization, is initiated and propagated by the cardiac conducting system. Depolarization is fastest in the atria, it's slowest in the ventricles. The impulses start at the SA node, the so-called pacemaker, the nodal cells in the pacemaker. The impulse travels through the cardiac myocytes to the AV node, and then through the AV bundles of His, which break into the right and left bundle branches, and then finally the Purkinje fibers, a subendothelial. These are the terminal ramifications of the cardiac conducting system. Regulation of heart rate can also occur by the autonomic nervous system, so parasympathetic nerves will decrease heart rate, and the neurotransmitter involved for that decrease in heart rate would be acetylcholine. Bradycardia means lower heart rate. The parasympathetic nerves come from the vagus, so that's from cranial nerve 10. Sympathetic nerves can increase heart rate, an increased heart rate called tachycardia. The neurotransmitter from the sympathetic nerves is mostly norepinephrine, and the sympathetic innervation to the heart comes from segments T1 to T6 in the spinal cord. Hormones can also regulate heart rate and the force of contraction. So epinephrine, norepinephrine can increase heart rate and the force of contraction. So we say they have a positive chronotropic effect and a positive ionotropic effect. Some substances can have negative chronotropic and inotropic effects. The central nervous system, as you know, monitors blood pressure and heart function by specialized receptors. We're not going to talk about these here, but you'll touch on them in physiology. There are baroreceptors, volume receptors, and various chemoreceptors. Here just shows some of the conducting system of the heart. So you can see nodal cells in the SA node and in the AV node. These are modified cardiac myocytes. These cells are smaller than normal cardiac myocytes, and they lack intercalated discs. On the other hand, Purkinje fibers are modified cardiac myocytes. They're larger than typical cardiac myocytes, and they do have intercalated discs. Here the Purkinje fibers are shown a little better. You can see the intercalated discs between them. This is a trichrome stain profile showing the endocardium and part of the myocardium. So here would be some endothelial cells on the endocardium. Here would be some of the Purkinje fibers, both in cross-section and in longitudinal section. Because these fibers are so large, you don't always have nuclei within the plane of section. The cells are large, so there's less of a concentration of the contractile myofibrils. Here you can see in the cardiac muscle the more densely staining cells packed full of the contractile myofibrils. But the intercalated discs here show very nicely in these Purkinje fibers. There are also some profiles of autonomic nerve fibers in this part of the endocardium. Here is just a profile of the myocardium, cardiac muscle. You can clearly see the nice intercalated discs. Note the central location of the nuclei in the cardiac muscle cells and this perinuclear area that's going to be rich in organelles and glycogen. At an electron microscopic view, you can see a cardiac myocyte, and you can see these secretory granules. Remember, cardiac muscle cells in the atria secrete atrial natriuretic peptide. This just reminds you of the development of the heart from a simple tube. There's a complex folding and rearrangement that occurs. I'm not going to hold you responsible for this for our course, but you would have remembered this from early in your medical school training and your embryology. The top is showing what would occur between day 22 to day 24, and then by day 28 you get the fully formed chambers in the heart. This table, again, we're not going over it here, but you're going to come to appreciate that there are a variety of different genes that are involved with normal heart function, and mutations in any one of these genes can cause congenital heart defects. This is something that you don't have to worry about right now, but you'll see it in pathology later, and you may see it later in your clinical training, depending on what you go into for your specialization.